Hello people, in this video let us look at cholangitis. In this we'll also be looking at a terminology called as Charcot's triad. Okay, which they will ask in the exam. Charcot's triad they'll ask in the exam. So remember, it comes in cholangitis. What is cholangitis, guys? So it is the bile duct that is infected. What is infected? Bile duct. Okay, bile duct. Bacterial infection is cholangitis. Itis is what? Inflammation. Here it is because of infection. So it is infection of the bile duct. It is cholangitis. Okay. And who are, first of all, where is this bile duct? Let's look at. So coming from your gallbladder and liver together, what is forming is this bile duct, common bile duct. Okay. So this part of it. Now what happened here? The bacteria, bad people have come and sat here. And which are these bacteria? Some E. coli, etc. Now this is cholangitis. Okay. Infection of the common bile duct. So infection of of the bile duct is cholangitis, which bacteria? E. coli, standard things that we love to blame. Don't blame Staphylococcus streptococcus, but okay. E. coli, Klebsiella, Pseudomonas, and there are some anaerobes also like Clostridium. Okay, so just remember to blame E. coli here. Very near to the intestine, we know we'll blame E. coli. No doubt there, right? Now, why does it happen? Because of choledocholithiasis. Means what? Stones of the bile duct, right? Choledocholithiasis, stones of gallbladder. Choledocholithiasis of the duct. So, stones in the duct. Stones in the duct led to what? Infection. Very good, people. Now, let's go back here. Biliary stricture. Some kind of a stricture means what? It's become narrow kind of a thing. Stricture. There's narrowing of that passage. Okay. Then, neoplasm. There's a tumor. Then there's obstruction. Pseudocyst of pancreas. Chronic pancreatitis. Then stenosing sphincter of OD. Sphincter of OD, where will you see, guys? See, this ampulla of water is controlled by the sphincter of OD here. Okay, that is controlling the secretions of the pancreas, etc. Basically, this is kind of a valve, right? And it is supposed to control how much gets out into the duodenum from the bile and the pancreas, etc., right? Then, parasitic infestation. These are less important. We will not bother about them. Post-ERCP, that is endoscopic retrograde cholangiopancreatography, right? So, post this, if stent cannot be passed as an obstructive jaundice cases. So, basically, there is something here in the bile duct which is causing stasis. And we all very well know that if stasis there, if things are not moving, what will come? Bacteria. Which bacteria will come? Which is nearest here? Near the intestine? E. coli. Very good. Now let's move on. So what are the symptoms of this cholangitis? So these people will have something called as a Charcot's triad. Let's look at this. They'll have jaundice, fever, and abdominal pain. So look at this guy here. He's having pain there because there's infection. He's having jaundice because there is obstruction. And he's having fever. Infection. Did we all mention all the three? Fever, right upper quadrant abdominal pain, jaundice. Charcot's triad, Charcot's triad, Charcot's triad, Charcot's triad. Did you get Charcot's triad? If they ask you Charcot's triad, I know, cholangitis. Very good. Now, where are we? Here. Let's come back. So how will you? What investigations you'll order for these people? Simply send infection, leukocytosis, obviously. Bilirubin, obviously jaundice. Alkaline phosphatase will be more. Remember, in cholangitis also alkaline phosphatase is more. Then standard, these are all blood tests and all you will do, no problem. Then we'll do ultrasound, CT, ERCP. That's it. Standard things you'll write. Now talk about cholangitis treatment. Infection, give antibiotics. Do endoscopic sphincterotomy. Fix the sphincter. Remove the stasis, let it move, remove the stones. If there is choledocholithiasis, remove these stones. Stones, hatao. Endoscopic stoning in case of stenosis or stricture. Just remove the stones. Percutaneous transhepatic biliary drainage. Go via the skin. I'm thinking from in this right up quadrant, wherever he has pain, go there via the skin. And then do the biliary drainage. Whenever there is high obstruction. High means you can approach it. It's maybe up. Laparotomy, drainage of common bile duct, T-tube insertion. This is very interesting actually. T-tube insertion. So look at this. They have put a T tube inside this. So drainage, it is helping, and it will help in the healing, looks like. That's the treatment, guys. So did you understand how to treat cholangitis? Infection, antibiotics? Yes. Remove the obstruction. Laparoscopy, percutaneous, do whatever. Remove the obstruction. T tube you can place. Very good. Very good. There is something called as pentad. Till now you saw triad, right? Fever, jaundice, right upper quadrant pain. That much is there in this also. See? This much is there. Some extra things they have added here. 2 more to make it pentad. Shock, altered sense, altered mental status. 2 more they added, it became pentad. Okay. This they'll not ask in the exam, but in the exam they have asked this Charcot's triad. Okay. See, cholangitis, Charcot's triad, remember. Okay. You've understood what Charcot's triad is, haven't you? Biliary colic, jaundice, fever. Okay. Bye-bye.